everybody. This is Dr. Jack Belitz, and I'm a chiropractor here in Omaha, Nebraska. We're not here trying to give medical advice. That's a very important thing to say on this particular issue. But we're here to give you great information that you can easily pull off the internet yourself. And
hello, everybody. I'm Aaliyah, Dr. Jack's assistant.
And we are here because we just absolutely love giving new information to everybody.
Well, we like talking about health. We like helping people be healthy. And a big part of health is mental health. And that's kind of where we're going today.
Okay, so this is something that is becoming more and more prominent in our practice right now. The topic is depression, and I got on this a little while back when I started seeing some numbers. Did you know that of women over the age of 35, 25% of them are on a prescription antidepressant? That is insane.
That's a lot of drugs with a lot of unknown factors and a lot of pretty severe side effects. So
it's crazy. We don't know how they work. It's just the facts. We don't know what they are doing. And I think one of the big reasons they've become so integrated in our society is because of the drug companies' ability to market directly to the end consumer, which, you know, is a relatively new idea.
I agree with that. I think that a big part of it is people like an easy way out. I mean, people take diet pills to lose weight instead of changing their diet and exercising. I mean, it's kind of, it's a thought process that I think has been created in our society that's scary and disappointing.
Exactly. And so what are these drug companies telling people? They're telling people, well, you have this chemical in your body called serotonin, and what these drugs do is they balance out the amount of serotonin.
Actually, they increase.
Okay, so here's the problem. First of all, 90% of the serotonin in your body is actually in your gut. It's not even in your brain. So, but that putting aside, we don't have the technology right now to measure the amount of serotonin in the brain. So the fact that a drug company is telling you that they are doing anything with the amount of serotonin in your body anywhere can't be proved. It just cannot be proved. And it gets me frustrated. And if you are on these medications, you have no reason to be taking them longer than 13 weeks because we don't know what they'll do to you. And so if you're on these drugs, who's been told, okay, you can have this for 13 weeks and you're done? People are on them forever. I have got kids as young as 8 and 9 years old that have been put on these drugs, and they are on them by the time they come to this office for 10, 11, 12 years.
Well, so here's the thing, is this seems to be the only modality people are trying to really use. And other facts and things that we know for sure is that the brain is elastic and it can grow and change, and we can change the chemical reactions that happen in our brain. And we can change those things without drugs. And that's kind of what's not being used adequately in the medical field, and it really should be.
Or how about it all? So here's the thing. There is a brain center in the brain called the hippocampus. And the hippocampus is kind of where all of your emotions are. And we know for a fact that people that are diagnosed with depression have a smaller hippocampus than the rest of the population. We also know that the size of the hippocampus can be changed. So I'm going to explain to you right now a little thing that you can do, a little exercise that if you are dealing with depression, if you think, wow, maybe I am a little bit, you don't even have to be clinically diagnosed to be doing this. If you just want to feel better, or if you have a child that's maybe struggling a little bit, do this with them. Be proactive. Don't get to the point where you have a diagnosis.
This works in a lot of ways. It's kind of, you know, you can use this for, like he said, better health, to lose weight. The power of the mind has untapped power and untapped potential. You can heal yourself by thinking about it.
That's right.
Really.
So here's the thing, is that we're going to be telling you to say positive affirmations called the I am thing to yourself. I am beautiful. I am successful. I am loved. Here's the thing. You don't have to believe them. When you say the ones that you need for your personal life, and if you need help with that, please let us know because we can help you figure out which ones you need. You tap into the ones that you are struggling with, and you just start affirming them. And I don't mean just say, I am loved, I am loved. I mean, you have to use intonation. You have to be in a good posture. You have to say it with belief, all right?
It also helps to say it in front of a mirror. Face yourself when you say these things if you can. So eventually your subconscious will catch up with your conscious thought and what you're doing, facing yourself in the mirror, telling yourself that you are worthy, that you are loved, that you are successful or talented, whatever it is you need to tell yourself.
Exactly. And so depression, all it is a series of chemical reactions that take place in the brain. Those chemical reactions are brought about by stimulus in your life, and they bring on these chemical reactions that cause you to feel depressed. Those are all controlled by the hippocampus. So if you start shifting the hippocampus, those chemical reactions start to change. And you will not have those depressing feelings anymore because those chemical reactions have been changed.
That's right. They use similar therapies. It's similar therapy to like EMDR for PTSD patients, where the eye movement and the thoughts, they start to like disconnect them. You can change your brain and the chemicals in your brain and your depression and your anxiety with exercises like this, and without drugs. And first steps towards getting a little bit healthier, because your brain and your body work together. So when your brain's healthy and your mind is healthy, other things will follow.
That's right. So
please like and share this. It's really important. Comment below with any questions or any help.
stay healthy, Omaha.